So what we expect from the auscultatory method of assessing the blood pressure is to listen to the sounds, a series of sounds. So as soon as the assessment starts, we are not going to hear the sound because the vessel is completely occluded, so there is no sound here. After that, at one point of time, say it may be 110 millimeter or 130 or 160. So the sound, for instance, this example shows the first sound is heard at 120 millimeter mercury, and then the sound is a series of sounds are heard, and at one point the sound disappears again. In this stage, the vessel regains original diameter, whereas in the beginning, before the first sound is heard, the vessel is completely occluded, so we are not hearing the sound. So no sound is heard at before and after this series of sounds. So what makes the sound to be heard? Well, that is because of the turbulence. So that is well explained in that article which I published. So the sounds are heard because of the cardiac output that comes and tries to open up the occluded vessel, and the turbulence is turbulence actually hits the wall of the blood artery, and we are able to feel that hear that sound through the stethoscope. So the sounds are caused by intermittent turbulence. So it's not at one stretch the turbulence creates reaches to the lowest blood pressure we measure. So the sounds are, the turbulence is actually intermittent. So in between, the intermittent turbulence means there is a period of silence between the series of sounds we hear. Maybe it's 12 sounds we hear, or 14 sounds we hear. So what makes this sound to be heard? So the intermittent, the phase between the sounds, the silent phase. So which that belongs to which phase of the heart? Does it belong to systolic phase or diastolic phase? So we know that the turbulence is caused by systolic. So the period of silence must be belonging to the diastolic phase of heart. So diastole is the phase where the heart goes for refilling itself. There is no cardiac output. So no cardiac output means no blood pressure possible during the diastolic. So this period of silence is because of the diastole. So it means this sound is also, all these sounds heard belongs to systolic phase of heart. So the first sound we notice as peak systolic pressure, and then we are not naming this these sounds, but we are naming this last sound as, according to my article, baseline systolic pressure. Thanks for watching.